Hello everyone, my name is Sepide and I'm going to present my smoking cessation project. Patient is a 27-year-old white male. His occupation is computer software engineering. Some of the systemic conditions that he currently has are chronic stress, anxiety, depression. He has a history of smoking for 9 years. He's currently taking 2 medications for his anxiety disorder. His BMI is 32.1, which put him in obesity category. He has a family history of cancer. His last physical exam was about a year ago, and he has a stage 1 hypertension. His ASA status is 2. Patient oral history. Patient never received dental hygiene treatment before. Patient also has poor home oral hygiene care. His chief complaint is dry mouth. Patient stated that he is interested in quitting cigarettes. However, he stated that he cannot overcome cigarette craving. I included his radiographs. So he has a generalized horizontal bone loss, and radiographic calculus is visible in all posterior teeth. Extraoral and intraoral examination was within the normal limits. He had generalized BOP, plaque index of 87%, calculus code of 4 medium. Patient has extrinsic stain from cigarette smoking. He has xerostomia, and he never had any restoration or any history of caries. Patient has bleeding when brushing or flossing his teeth. His AAP classification is generalized stage 2, grade C, and his prognosis is poor. Patient a smoking pattern. Patient has a history of smoking for 9 years. He smokes 10 to 15 cigarettes a day, and he also smokes every day. Some of the current systemic conditions that patient has are anxiety, stress, depression, insomnia, obesity, alcohol consumption, since the patient consumes 7 to 8 drinks in a week, and a stage 1 hypertension. So these are some of the topics that was discussed with the patient. Smoking can increase the risk of getting some serious systemic conditions such as lung cancer, atherosclerosis, a stroke, and it can be even fatal. So according to CDC, smokers are 15 to 30 times more likely to get lung cancer or die from lung cancer. The chemicals you inhale when you smoke cause damage to your heart and blood vessels that makes you more likely to develop atherosclerosis or plaque buildup in the arteries. Also, CDC reports people that smoke have more risk of getting a stroke by 20 to 30%. Oral risk factors of smoking was also discussed with the patient, such as bad breath, caries, staining, periodontal disease, tooth loss, oral lesion, oral cancer. So most of throat and mouth cancers are linked to combination of smoking and drinking. Also, smoking can cause xerostomia, root decay. It can impair inflammatory and immune response system, so therefore it can delay wound healing and increase progression of periodontitis. Smoking cessation was recommended to the patients since it can help with cigarette cravings. They also have some counselings, behavioral therapy, and stress reduction therapy. They have also some medicines and nicotine containing products that can help people with cigarette cravings. Some of the smoking cessation nicotine products are spray, gum, candies, pills, medicines, and nicotine patches. Some of the other recommendation to the patient was performing daily exercise. It can help with nicotine craving, stress reduction, and insomnia. Avoid alcohol consumption because alcohol can cause cancer and increase cigarette cravings. Eat healthy diet. Include more fruits and vegetables in your diet. Choose xylitol gum. Xylitol gum can help with xerostomia. Practice yoga. Yoga can help to reduce stress and therefore reduce cigarette cravings. I also gave my patient this brochure so he can take it home. So it's basically whatever that I discussed with the patient, such as why quit smoking, the systemic and oral conditions that are related to smoking, and what are some ways to quit smoking. So it's basically everything that I discussed with the patient. So the outcome was that patient stopped smoking completely. Patient is also compliant with OHI and all the recommendations. He also stated that his mood improved since he stopped smoking cigarettes and he's feeling less stressed. However, patient did not enroll in a smoking cessation program, and benefits of smoking cessation was discussed with the patient again. So I included his intraoral pictures both before and after the treatment in this slide. The overall result was good. There was improvement in the salivary flow. Also, patient stated that he's feeling happier. There was no BOP, plaque index only 4%. Gingiva appeared healthy and pink. There are no staining on the teeth anymore. And patient also stated that he's feeling better about his smile. There was also a reduction in blood pressure. So this time blood pressure was only 120/70, which is within normal limits. This is my reference, and thank you for watching my video.